Hello friends, myself Agale Krishna. I am working as an assistant professor in Mula Education Society's College of Pharmacy, Sonai. Today I am going to discuss about provisions governing the manufacturing of drugs under Drug and Cosmetics Act 1940 and Rules 1945. So in this lecture I am going to discuss about the introduction to the D&C Act, then objectives of the D&C Act, then constitution of Drug and Cosmetic Act, as well as various points, just like how this act is divided into 5 different chapters, as well as how the rules are divided into 27 parts. Then I'm going to discuss about the part 7 of the Rules 1945, that is manufacturing of drugs other than homeopathic for sale. Then types of manufacturing licenses, then forms required for manufacturing of different classes of drug. So there is a requirement of different types of forms for manufacturing of different classes of drugs. Then general conditions for grant or renewal of licenses. Then conditions of licenses in the rules. Then cancellation and suspension of the license and prohibition of manufacturing of certain classes of drugs. Then lastly, the offenses and penalties under D&C Act regarding the manufacturing of drugs for sale, distribution, then exhibited for sale and distribution. So Drug and Cosmetic Act was enacted in the year of 1940. It was actually enacted on 10th April 1940 with the main objective is to regulate the import, manufacturing and sale as well as distribution of drugs in India. This act is divided into 2 points. First one, that is the act, and second one, that is the rules. So act is constituted with 5 different chapters. First chapter is introductory, which includes all the definitions. Then second chapter is regarding the administrative bodies like Drug Technical Advisory Board, Drug Consultative Committee, then Central Drug Laboratories. Also, third chapter includes import of drugs and cosmetics. And next chapter, that is chapter 4, is related to the manufacturing of drugs for sale, distribution of drugs and cosmetics. Then chapter 4A is having the separate provision for the manufacturing as well as regulation of the Ayurveda, Siddha and Unani drugs. And in the last chapter, that is chapter 5, is related to the miscellaneous. That is those points which are not covered under these 4 chapters are covered separately in a miscellaneous chapter. Also, this act is consists of 2 types of schedule. First one, that is schedule to the act, and second one, that is schedules to the rules. So there are 2 schedules to the act. First schedule includes all the books, that is Ayurveda, Siddha and Unani books. And second schedule to the act includes the manufacturing and import provision related to drugs and cosmetics. Also, there are 27 different schedules to the rules. The next point, that is manufacturing of drugs other than homeopathic. So in case of manufacturing of drug, a separate license is required for the separate facilities. First of all, those persons who are interested to apply for the manufacturing licenses have to apply to the licensing authorities appointed by the state governments. Also, the licensing authority controls the manufacturing operations by appointing the drug inspector. Drug inspector is having roles regarding the inspection of the premises in which the manufacturing is supposed to carried out. Then all the inspection reports are submitted by the drug inspector to the licensing authority, and if licensing authority is satisfied by all the documents as well as evidence provided by the drug inspector, then they can issue the license from the CLA, that is the Central License Approving Authority. The license will be granted and notified in the official gazettes. So every license need to renewed within the 6 months of its, before the 6 months of its expiry. Then types of manufacturing licenses. So first is the manufacturing license. A person who is having his own facility for manufacturing may apply for the manufacturing licenses in a prescribed form. Also the second one, that is loan license. Loan license is a license granted to a person who does not have his own facility for manufacturing, but he intends to own a facility owned by the other manufacturer. So in that case, the licensing authority verifies all the requirements. Those are fulfilled by the manufacturer who is having their own facility. Also the capacity of plant is taken into consideration while discussing the loan license. Then repacking license. So license in case of a drug which is taken from the bulk container. That means a bulk container is divided into the small units, and those units are labeled accordingly. But this is not happen in case of the regular course of retail work. So here is the list of various forms which are required for the manufacturing of different classes of drugs. So table shows types of license, class of drugs and forms. So there are different types of licenses issued accordingly. First one, that is manufacturing of drugs for sale or distribution. Then second one, manufacturing of cosmetics for sale and distribution. Then manufacturing or a loan license for the manufacturing of drugs, as well as the repacking license in case of the repackaging. So in the first, that is manufacture of drugs for sale or distribution. So drugs or a grant or renewal of a license for drugs, those other than C, C1 and X, as well as part XB, the application shall be made in a form 24. Then grant of license will be in a form 25, and the renewal certificate will be granted after applying in a form 26. Then grant or renewal of a license for the manufacturing for sale of drugs specified in Schedule X and Part XB. The application shall be made in form 24F. Then the grant of license will be in a 25F, and lastly the renewal certificate will be granted in a 26F. So Schedule X is a habit forming psychotropic substances and other such drugs. So that's why there is a separate provision for the Schedule X and Part XB drugs. Then drugs specified in Schedule C, C1 excluding Schedule X and Part XB, the application shall be made in form 27, it will be granted in form 28, and renewal will be in a form 26. Then for manufacturing of the drugs specified in a Schedule C, C1 and X, as Schedule C is a biological and special product, C1 is a biological and other special product, and X is a habit forming and psychotropic substances as well as such other substances. For that purpose, applicant need to apply in a form 27B, the grant of license will be in a 28B, and renewal certificate will be granted in 26. Then for the operation of blood bank as well as processing of whole human blood for components and or manufacturing of blood products, applicant need to apply in a form 27C, then grant of license will be in a 28C, and lastly the renewal certificate in a 26G. So for the manufacturing of large volume parenterals, sera and vaccines other than those specified in Schedule X and Part XB, applicant need to apply in a form 27D, the grant will be in a 28D, and renewal certificate in a 26H. So any individual, if they want to manufacture a drug for the examination test or analysis, that time they have to make an application in a form 30, the grant will be in a 29, but such a certificate will not be renewed. Then in case of repackaging license, so repackaging is considered only in case of drugs other than the C, C1 and X. So application shall be made in 24B, granted in a 25B, and lastly renewed in a 26B. Apart from this, so in case of loan licensing, So applicant need to apply in a form 24A, granted in a 25A and renewed in a 26A in case of drugs other than C, C1 and X. Also in case of drugs specified in C, C1 and X, they have to apply in a 27A, granted in a 28A and lastly renewed in a 26A. The next point, that is general conditions for grants or renewal of license. So in case of the various forms, so there are some general conditions as well as conditions on license. So in case of 25 or 25F, that is in case of grant or renewal of the license of drug other than CC1 and X and drugs included in a CC1. So in that case, so first condition is that the industry or manufacturer must have the competent technical staff. So competent technical staff is any person who is graduate in pharmacy or pharmaceutical sciences or having any degree related to pharmacy, must have the minimum 18 month of experience. Then the person who is having degree in a science with the chemistry as a principal subject requires 3 years of manufacturing experience. Then person who is having chemical sciences or a degree in a chemical sciences or chemical technology must need a 3-year experience. Apart from this, any individual that licensing authorities thinks to have a prescribed qualification or any foreign qualification, that time they may grant for a person to eligible for a manufacturing. Then conditions of license in form 25 and 25F. So there are various conditions on these forms, just like a manufacturing facility must comply with the Schedule M, as Schedule M states that good manufacturing practices for drugs. Then also it includes that manufacturing and analytical records must be kept for minimum of 5 years, and that must follow the Schedule U. That Schedule U is the particulars to be included in the manufacturing and analytical records of the drugs. Then prohibition of manufacture of certain classes of drugs. So any drug which is not of standard quality, which is adulterated, spurious or substandard, are completely prohibited under section 18. Any patent or proprietary medicines of which label does not contain a true formula is completely prohibited. Then any medicine or any drug that claims to cure or mitigate any disease or disorder in a Schedule J, as Schedule J is a class of diseases and ailments that a drug may not claim to prevent or cure. Then any drug in contravention to any provision of the rules as well as any provision of the Act. Then any drug not intended for sales, as well as any drug intended for the free distribution to the member of medical profession. Such a kind of drugs or classes of drugs are completely prohibited from manufacturing. Then the last point of this discussion, that is offenses and penalties under section 27 and 27A. So anyone who himself or by any other person on his behalf manufactures for sale or distribute any drugs or medicines, after taking such medicine, if any persons caused a death or that medicine caused a grievous hurt, that time a person is subjected for a imprisonment not less than 1 year, which may extend to 3 years, or in a first conviction, and a subsequent conviction a person may subjected to the life imprisonment. Then penalty for, also there are some drugs like drugs which are adulterated or spurious. In that case, the person will be having punishment for not less than 3 years with the fine of ₹5,000. Then penalty for non-disclosure of the name of the manufacturer. If any person is having any active ingredients or drug material whose manufacturer is not disclosed to the drug inspector, in that case the person is subjected to the penalties, that is not less than 1 year of imprisonment with the fine. Then penalty for not keeping documents, etc., and non-disclosure of information. Any person who fails to maintain a documentation as well as records will be subjected to the punishment not less than 1 year, which may extend to the 2 years with the fine not less than 1,000 rupees. Then penalty for manufacture, etc., of drugs or cosmetics whose manufacture, sale, etc., is prohibited in the public interest. Such a person who manufactures the drugs which is prohibited in the public interest will be subjected to the punishment of not less than 3 years, which may extend to the 6 year with the fine of not less than 10,000 rupees. Then penalty for use of government analyst report for advertising. So any person who uses the government analyst report, that is report from the central drug laboratories or other government laboratories for the advertisement of his product or the drugs, that time he will be subjected to the punishment. On the first conviction, he will be fined with not less than rupees 500. On any subsequent conviction, the imprisonment of not less than 10 years, which may extend to the 20 years, along with the fine of not less than 10,000 rupees. Thank you.